Hi everyone and welcome to today's video. So today we're discussing PCOS or polycystic ovary syndrome, a condition that affects between 5 and 25% of women in their reproductive years. Now, if you've been diagnosed with PCOS, it can feel a little bit overwhelming, but the good news is there are ways to manage the symptoms, and I'm here to guide you through understanding the condition and how you can be supported with conventional and natural approaches. So first of all, what is PCOS? It's important to understand that it's more than just an ovarian cyst. It's a metabolic and an endocrine disorder. In fact, it's possible to have PCOS without having any visible signs of cysts on your ovaries. The underlying issue is that women with PCOS tend to have higher levels of androgens, hormones that can disrupt the menstrual cycle, cause mood changes, and lead to symptoms like acne, hair loss, or facial hair, hirsutism. Now, one of the key features of PCOS is that it's often linked to insulin resistance, meaning that your body struggles to use insulin properly, and this can lead to higher levels of androgens, further worsening your symptoms. So we have insulin resistance, which can cause androgen levels to rise and disrupt normal hormone balance. You can have high levels of luteinizing hormone compared to FSH, and this is follicular stimulating hormone, leading to ovulation problems and cyst formation. You can have excess estrogen, which can play a role with hormonal imbalances, feeding a cycle of irregular periods and other symptoms. Stress can be a major factor with CRH, corticotrophin releasing hormone, and adrenal hormones contributing to elevated androgens. Then there's genetics. So you may have a family history of diabetes or baldness or menstrual irregularity causing and increasing the risk of PCOS. So the symptoms of PCOS are quite variable from woman to woman. They include things like irregular periods or no periods at all. That's amenorrhea or oligomenorrhea. Heavy bleeding during periods due to an anovulatory cycle when you don't ovulate. So a bleeding that prolongs for a period of time because your ovulation's not taking place. You may have acne, hirsutism, or your hair may be thinning. You may have weight gain or difficulty losing weight, though many women with PCOS are not overweight. So this is one where typically women will be more inclined to be obese or find it really difficult to lose weight. But PCOS can also happen with women who do an awful lot of exercise and their androgens are high because of the amount of exercise they're doing. Women can have mood changes, anxiety or depression, and then infertility is a real factor with PCOS, as are recurrent miscarriages. Now, over the long term, women with PCOS are at a higher risk of endometrial cancer, type 2 diabetes, and cardiovascular disease, so it's important to manage the condition with the right support. Like conventional treatments for PCOS aim to regulate the hormones and manage symptoms. So you might be given clomiphene, which stimulates ovulation, metformin to improve insulin sensitivity, hormonal contraceptives to regulate your period, but sometimes that can worsen your insulin resistance, spironolactone, which can reduce acne and hirsutism, and progesterone to trigger a period if your cycles have stopped. Now let's talk about the herbal medicine and how it can support women with PCOS. Now, herbal treatments focus on balancing the hormones, improving your insulin sensitivity and reducing symptoms like acne or hair loss. Some of the key herbs for PCOS include cinnamon, galega, and fenugreek, which are all hypoglycemic herbs that help balance your blood sugar and improve insulin sensitivity. Chasteberry or Vitex agnus castus is great for balancing hormones and regulating cycles. Licorice and peony work to reduce the androgens and support the ovarian function and promote hormonal balance. Black cohosh helps to regulate LH and FSH ratios and improves pelvic circulation. And then flaxseed and nettle root can increase SHBG. This is sex hormone binding globulin, and they help bind excess androgens and estrogen. Now, herbal adaptogens such as ashwagandha, rhodiola, panax, ginseng can also be used to help manage stress and support the HPA axis. This is the hypothalamus, pituitary, and adrenal axis, which is key to reducing the hormonal imbalances caused by PCOS. So moving on then to diet, because it's one of the most important factors when managing PCOS. Here are a few of the guidelines. Focus on anti-inflammatory foods such as leafy greens, berries, fatty fish, and olive oil. Avoid processed sugars and refined carbohydrates, which can make your insulin resistance worse. Include phytoestrogens in your diet like flaxseed, soy, legumes, which can help balance your hormones, and eat regularly. Avoid high carb breakfasts. Try and consume most of your carbohydrates at lunchtime and keep your blood sugar stable throughout your day. A Mediterranean diet, low carb or ketogenic diet can be really helpful for women with PCOS, particularly if you're struggling with insulin resistance. Now, in addition to herbs, some supplements can help support hormone balance and insulin sensitivity. Omega-3 fatty acids, vitamin D, selenium, and zinc can all play a role managing PCOS. NAC has been shown to improve insulin resistance and ovulation rates. And then flaxseed at 1 tablespoon daily can help bind excess hormones. Lastly, make sure to exercise, but don't overdo it. Too much strenuous activity can actually worsen your symptoms in some women. Now, PCOS is a complex condition, but with the right combination of herbal remedies, diet, and lifestyle changes, it's possible to manage your symptoms and support your overall well-being. Whether you choose conventional treatments, herbal medicine, or a combination of both, it's important that you do take a holistic approach that works for your body. Thanks for watching the video. If you find it helpful, useful, and please do share it with others that may benefit from it. And that's it for me for now. If you need to contact me to talk about your case individually, you can do so at thewildsage@proton.me, or you can contact us through the website at www.thewildsage.co.uk. Cheers.